Protein Healthy Round Rock Weight Loss alongside with Dr. Binner. And we have a really great topic for you today. A little bit TMI, but definitely something we need to talk about is constipation. Ideal Protein, a lot of people that are on phase 1, this is something as a coach that I hear from my dieters, and so we want to ask Dr. Binner kind of what are some great strategies that can help us with that.
Absolutely. Yeah, so this is a big one,
Mm-hmm.
and there's no simple answer. We'll have 20 people with constipation, and we'll have 15 different causes. Okay,
Mm-hmm.
so that's one of the reasons why I think the way we have our program set up, we have our roundtables, okay, when they're absolutely needed, and where we get people together that have issues with constipation, plateaus, energy, whatever it may be, that we talk about these issues. So let's have a little roundtable right now. I believe in starting simple, and one thing that Ideal Protein has is they have a product, Senna, that is the first thing that I would go to, because
Right here.
what we want to do is Senna will give you a little bit of a laxative effect,
Yeah.
and push through things and so on and so forth. And so start with that. Don't start with too many things. Start just with one thing at a time and layer it on, because if you try too many things and it works, you don't know it worked. And sometimes the body can't handle too many things at once, so start simple. Another thing that tends to be an issue in Ideal Protein clients, or just everybody out there, is that about 90% of the population is deficient in magnesium. Even though Ideal Protein has a significant amount of magnesium in their product, in just absolutely wonderful vitamins, sometimes you need a little bit more. You really do, because we live in a society that stress is high, and our gastrointestinal system is sometimes in a sympathetic mode instead of a parasympathetic. And so sometimes by adding that magnesium, it does two things. Helps calm our nervous system down. It helps relax our muscles a little bit, and part of our gastrointestinal system is going to be that rhythmic contraction that is run by muscles, by the way. And then secondarily, what it does is draw more water into the bowel. And if we are one of those individuals that are not hydrating well, and Judy, we have clients that don't hydrate well, right? And that's an issue. That helps draw water into the bowel, and so that a lot of times can turn things around. You should be eating plenty of fiber. And so we'll have another video if you're not eating enough fiber. Even if you are and your body needs a little extra, we'll talk about how to add that fiber in. Sometimes it's just about lubricating the bowels a little bit more. When you're on phase 1, you're only having a little bit of oil, just enough, okay? But sometimes it's necessary to actually increase that oil content. Remember, the oil, healthy fats that we put in our diet are not going to be insulinogenic. They're not going to increase the insulin. So sometimes just tweaking that phase 1, hey, by the way, if you do this, talk to your coach first and talk to your doctor, because they need to know exactly what's going on and give you the yay or nay, because they're familiar with you and I'm not. But sometimes just adding that little extra teaspoon of oil a couple times a day will lubricate things. But start with the Senna, go with the magnesium, then go with a little bit of the oil, and there can be other factors as well.
Great.
But because we're limited just by talking about this in this video, we'll just kind of keep it right there, and the rest would have to be handled by your coach.
Yeah.
Does that make sense?
Yeah, perfect. Thank you.
All right, guys, have a good day.